Okay, I'll call this special regional council meeting to order. Please be advised that tonight's meeting is available for the public to attend virtually and is being streamed and recorded. Can I get a motion, please, to adopt the agenda? Moved by Councillor Penny, seconded by Councillor Andrews. All those in favor? Carried. Villers, Mr. Dan Campbell, welcome.
Thank you.
Good to see you again.
Good to see you.
Good. Without further ado, I'll let you take over and tell us about medical transport.
Okay. I can assume that everyone received the initial proposal that we wrote entitled Planned Medical Air Transportation in Northern Rockies Regional Municipality. I'm going to assume that everybody has had an opportunity to read through that. I'll just go briefly over the different sections in kind of a point form, key items in there, and try and give you a bit of an overview and then open the floor to questions if that's acceptable.
Sure, that's fine, Dan.
Good. So basically the proposal is regarding transportation of individuals in the community to medical services that aren't provided within the community. So having been in the community, and a member of the community for a long time, I've seen that a lot of the services can't be provided here. And if we can't provide those services here, whether because they've been withdrawn or services have been centralized, the idea is that we bring the patients to the services that they require. We are willing to make the investment in the company to expedite that and bring some more capacity in and some scale to bring the costs down. But we need to have the support of the community to sort of justify doing that. Villers has been in the community for 40 years. I've been here for almost 13 years. We recently had an ownership change, so I've taken over the ownership of the company, but we're not changing the values of the company. We still work with the previous ownership, and at least Peter Villers still flies here. So not a lot is changing for us. We do service a lot of different markets in the economy. I think providing medical service or travel to medical services is just another aspect of that. It won't change our core operations at all. So I know you're all very familiar, but I'll just quick review of the current state of the health services. Although the services may increase if we have a population increase, I think we're only ever going to see more demand for medical travel, not less. Just based on the increased population. In my opinion, it is likely that services will continue to be centralized. That's the trend that I've been seeing, all throughout the north. It looks like Prince George seems to start being the major hospital, or Fort St. John. There was a survey in 2019. They brought some stats up just quickly. At that time, it was an average of 100 patients per month being referred outside the community. And currently those costs are all being placed solely on the patients to go outside and seek that the services required. Of the people that answered the survey, 96% of those surveyed were required to travel in the previous 12 months. And it was estimated that residents spend approximately $1.9 million annually to access services outside the community. So some pretty big numbers. So basically, the model that I've proposed, it's not new. I didn't come up with it. It's kind of, it's done all throughout the north, in the Northwest Territories and the Yukon. We've actually been participated in this model, flying people from Fort Liard into Yellowknife, because that's where their centralized medicine happens. So what really occurs is the appointments are scheduled. So we would, work with Northern Rocky or with the Northern Health and schedule Northern Rockies residents to have appointments very close together, so that we could bring the group down from here. They could all get their appointments done in a timely fashion, then we could return them all on the same day. If this is done, in the most expedient method possible, I think it's likely you could go for your appointment in the morning and be back just after lunch. All right. We would arrange transportation to meet the aircraft. So, basically just one bus at the airport when we get there, brings everybody into the hospital, whether it's Fort St. John or Prince George, and then brings them back, and we bring them back here, and they can arrange their own transportation from the airport here. So it's same day there, same day back service, which I think is the key. So I'm just going to talk a little bit about our capabilities now. Right now we're flying. We can operate up to 5 in all kinds of weather, up to 7 if the weather is fair weather. In our Navajo, we could make some expansions in that aircraft and just get up to the 7. It would require some avionics investment and things like that. But what I'm really hoping for is that we'll put a King Air 90 online, and then we'll be able to take up to 8 passengers to somewhere like Fort St. John or Prince George. So there is an outline there of what the costs are, sort of per flight and per person. If we break it down into the King Air, we're looking at $540 a person to Fort St. John, or $825 per person to Prince George. Sorry, $1,041 per person to Prince George. When you break those numbers down to what you saw earlier, we were talking about $1.9 million being spent. If we took every one of those people and flew them to Fort St. John, that's getting referred out of town, that 100 patients a month, we could take them all there for $650,000 and bring them back same day. So I mean, the numbers seem high per seat, but when you look at what everybody's spending already, it gets a lot. It looks a lot more efficient. So just in a summary, I think this is a problem that we can solve. I look at it as, if we can't have the services here, let's get to the services. What's the best way to do that? We got the technology. It's sitting right here in my hangar. Let's take people to where they can get healthcare. It'll elevate the health and welfare of the community, and we're willing to invest in the infrastructure to get that job done. And we're willing to help with the organization of the transportation, as well as whatever parts of the program that we would have to participate in, or we could help with. We would help with. So basically today, I'm asking that the Northern Rockies Regional Municipality would be in support of this project, or by providing a letter of support and advocacy for this project where appropriate. We're not at the stage of funding yet. I'd like to get the support of the local communities, both the Northern Rockies, and I'll be talking with the Fort Nelson First Nations, as well as the Prophet River First Nations and the First Nations Health Authority. Given that we have support from all those different groups, I'll probably move forward with some kind of a funding model. I'm not sure at this time what that looks like. Personally, I would hope that the province would provide some funding for it, because I think that's really where the onus lies. But we'll see where we can get to with that. So that's all I have to say about it.
Thank you, Dan. I'm going to ask for questions from councillors now. Do you have any questions for Dan? Any comments? Councillor Souls.
I think this is actually a really great initiative. It's pretty obvious to some of us here that we've termed it centralization of services, and the idea of not having centralized transport to the services leaves us on the outside looking in. It's like a no-brainer. But I think it's complicated, and I really appreciate the angles that you're taking. I think when you look at the numbers, so your cost per unit of flying someone to Prince George or to Grand Prairie or to Fort St. John, your plane has to be full in order to have those numbers work for you. And it takes a coordinated effort. Somebody that's really good at logistics has to be intimately connected to the referral process on this end and the service on the other end. And that's where I see the challenge is. I see that your service in the middle of that is a great idea. It's really good.
Councillor Roper.
Sorry about that. Thanks very much, Dan. That was a great proposal. I've always felt personally that this is part of the answer to our problem. If we can reduce a round trip of 8 or 9 hours driving into a 2-hour flight time, that would take a lot of the burden off of our people. What would happen, let's say, with companions? Let's say we have a referral for a person that requires a companion to go with them. Would that be the same as would that be the same cost for their seat as a patient, or like how would that work?
Yeah, John, unfortunately there's just a limited number of seats on the aircraft, and the cost of the aircraft is fairly set. So if we have to add a companion, it basically just doubles the cost onto the existing cost already, and maybe takes a seat out for someone else. Now, some people would require a companion. That's absolutely true, and I've seen that a lot. However, with a scenario like this where we're managing a lot of the logistics for everyone, we can also help assist with that. We're going to have both the pilots are going to be there to help on and off the aircraft. And then there'll be, a bus where we'll be able to get people right into the bus sort of thing. We could even bring the bus right out onto the apron and move people onto it. So there'll definitely be some extra assistance there that might lead to not needing those extra people. But absolutely, there will be people that require someone there to help them directly. And that basically will just be a double cost on top of it.
Thanks, Dan. And
Councillor Gerwin?
Oh, sorry.
Go ahead, John. Finish off your question then.
Just a quick follow-up. I don't know if it was in the proposal or not, but how many flights a week would you say would cover the community's needs?
I think we could fill up 2 flights a week with the numbers that you're looking at here, even if we only got 80% buy-in from patients. I don't see it as starting that way. I think probably, you start with 1 every couple weeks and build up to, I think it'll probably be dictated by the budget of what we can afford to offer people, really. I think once that catches on, that most people, or a lot of people would want to fly out and fly back same day. I see it as, at best, probably twice a week would cover what we need. And the nice thing about that is we're only ever gonna go when the airplanes can be filled up. So we won't be operating. If the demand isn't there, we won't be flying, right?
Thanks very much, Dan. I'm very encouraged by your proposal and the forward thinking on this. I'm really looking forward to seeing if we can get this off the ground, pardon the pun.
Councillor Gerwin?
Great, thanks, Dan. That was really, really good. I think it's the longer we're in this whole healthcare dilemma that we have here. Every time we seem to open a file or open a door, it all comes down to coordination. You know, like everything needs to be coordinated, and I think we've all had experience with health authorities' lack of coordination in terms of moving people or moving services. So I'm glad that you identified that really early on, that coordination is going to be key. And I think something that came to mind as you were speaking is, I think we forgot about the travel assistance program that the province runs. We haven't utilized it here because it doesn't cover mileage, but it does cover airfare. So I would need to look into this a little bit more, but I think that there might be an opportunity to just get some parameters on that travel assistance program. You can Google it. It's offered by the BC government. And if I'm remembering correctly, you just have to have your doctor or health service provider sign a form that says you need to go to get this done, and then or part thereof of your airfare is covered. So that would be something that we should further investigate. And then the other thing that came to mind too is that some of our residents do have travel assistance insurance that would cover a flight like this. So I think that coming back to the whole coordination piece around all of it, whether it's coordinating appointments or coordinating funding, different funding models. So I think that there's work to be done there. Would have no hesitancy in making a motion to provide a letter of support today. Would encourage you to make sure that you CC it to, you know, the appropriate Dan Davies and all the other places. Thank you.
So Dan, you'd spoke about, you know, a lack of provincial government assistance with something like this, and you know, the provincial government has been, what would you call it, reticent in, you know, providing assistance for travel out of Fort Nelson, but never say never. As Councillor Gerwing pointed out, there may be these programs out there that will assist people in doing this, which can only help your proposal here. So I'm not entirely skeptical that we can't get any assistance from the provincial government. You never know until you ask what assistance might be available. So I wouldn't totally throw that idea away. We may be able to get something from the health ministry some way or another. Councillor Gerwing, you wanted to make a motion to support Mr. Campbell's request, and Councillor Penny is seconding that motion as well. All those in favor? Carried. Okay, Mr. Campbell, thank you very much for your presentation today, and appreciate you coming in and seeing me as well. So, yeah, good luck with your proposal, and we'll be in touch further.
All right, sounds good. I'm sure we'll have some further discussion on this. It's a little ways from the finish line, but it's a step in the right direction. Thank you all.
Thank you.
Thanks, Dan.
Coming before us, Fort Nelson Snowmobile Club, but they are not here yet. Is that correct? 5:45. Okay, I will ask then to temporarily adjourn this special regional council meeting. Moved by Councillor Souls, seconded by Councillor Andrews. All those in favor? Carried. And we are temporarily adjourned. Okay, I'll call this special regional council meeting back to order. We have here today the Fort Nelson Snowmobile Club. Wayne Wheeler is here to do a presentation. Wayne, please. Good to see you, Wayne.
Thank you, Mayor and councilors, for having us tonight. For those that are home listening, Wayne Wheeler, President of Snowmobile Club, and we have Vice President Gary Millay here, who will take over the chair after I give a brief presentation. As of 2012, when I took over Snowmobile Club, Gary and I have increased our memberships from 8 members to this year to 114 members. We went from having no trail around town to having a partial trail around town with the help of mayor and council over previous years. In 2012, we had 1 shelter. As of today, we have 3 different warm-up locations along our trail route, which is over 110 kilometers of groomed trails. We have 10 rest areas along our trail system. 2 are equipped with pit toilets, and all 3 shelters have toilets as well. And we are applying for another pit toilet on our trail system within town limits. Most of our work with the Snowmobile Club is done by 6 to 10 dedicated members per year. That includes firewood detail, grooming trails. We started off with 1 snowcat and 1 snowmobile, or 1 drag for the snowcat. And as of today, we've accumulated another snow machine, for snowcat, drag for that machine, and we also have 2 snowmobile drags to pull behind the skidoos to help maintain the trail in town. So quit faster than the snowcat in town will take anywhere from 8 to 10 hours to do around town, and with the 2 skidoo drags, you can do it in less than 3 hours. I won't get too much into the tourism for the trails and everything, but as of Gary will touch base on that stuff. That's just a bit of the history of the club, what we've turned around in the last 10 years. I will turn it over to Gary Millay at the moment, and he will address what we are looking for from council and mayor today. Thank you.
Thank you, Wayne.
Good evening, everyone. Thank you very much for having us.
Thank you, Gary.
You bet. We'll start off with, I believe in front of you, just to give a little detail on the Snowmobile Club that we've been taking part of. We as Wayne mentioned earlier, we started with about 8 members, and most of those were the executives at the time, and now we've grown into about 115 members that are actively out on the trails. And from the 2020 budget, you can, as you see right here, the revenue, they say is 38,000 is where total revenue. Most of that revenue has actually come from our membership that we ask the members to be part of the BC Snowmobile Federation, of which we pretty much have to give half of our membership dues to the BC Snowmobile Club, and we get half of the remaining. And our donations make up a big portion of our contributions from the town that we've been very fortunate over the years. But again, it's getting tighter in town, so those donations are much harder to get. We usually have a sales event either by a ticket lottery that we usually make about $5,000 to $6,000 on. That helps with our operations, with maintenance of the trails, the shelters, the grooming, and also a lot of the fuel for these 2 snowcats are actually donations as well from our few businesses around town. And then as we get down to expenses, of course, I won't go through all the details, but at the end of the day, we end up with about, I think last year in 2020, we ended up with about $3,000 roughly that we could carry over into this year, which really is only enough to pay for insurances on. We must carry on the 3 shelters. And if you look on the second page, of course, kind of just go over what our assets are. If you look at it, I mean, we have, between the 3 buildings, we're looking at about $80,000 is what we have for assets between the snowcats, the shelters, and everything else. So it's starting to build, and of course, with that comes extra maintenance and costs. And 2020, we carried forward $3,000, and of course, if you look at 2021, where we are currently right now, up to date here, we are sitting with about $6,000 in our account, just a little bit over $6,000. And again, we have to make sure that we have cash going forward into next year to pay for insurances. We're operating on a very thin margin of profit. And in saying that, I'm going to call up, you're ready there to bring up. As you can see on the map there, on the northern section, this was a new section that we had applied for the NDIT for a grant to get that, so we have access around town for the kids and everything to make. They're not on the streets, they're not up and down the alleyways or on the walking trail. And then, so this is complete, but on the south section, we have a proposed route that is sort of we've got it started with some donations. It's been mulched. What we're facing is, of course, a cash flow issue. And since last year, there was 3 grants that we could have applied for. But the problem with these grants is, like,
I've lost audio.
I as well.
I see Jaylene down at the end. They must be trying to fix it.
Councillor Roper, Councillor Andrews, Councillor Gerwin, or Councillor Dolan, can you hear me? Okay.
And now,
Yes, I can.
Thank you. Mr. Millet, would you like to continue, please?
Sure, you bet. Thank you. As I was saying, the north section of the town there, we applied for a grant through the NDIT, which, at $44,000, that gave us from pretty much, a working trail system that was good for our winter activities, of course, because for the snowmobile club, it's very low impact. But the problem that we're having, it is actually deemed a motorized trail, so it is used all year. And from the quads, dirt bikes, and everybody else. I mean, we have lots of user groups on that one, from walking. I think there's even people out doing some cross-country skiing, and of course, then between the quads and the side-by-sides. And because of this, it's, over the last couple of years, it's really taking an impact on the trail system. We knew we had some wet spots that were there, but of course, over the years, they have grown now to be what we deemed as a hazard. They're very deep, and the problem with it, like anything else, people are trying to, go to the side of these big water holes, and we'll show some pictures here just shortly of those. But again, as I mentioned, on the south side, we're trying to complete the complete loop, so that way you don't have to be in the town network. It's safer for everyone. But again, the grants that we've applied for required input, and the last three we did, we needed a minimum of the club's input of around $20,000, and that was the start. And as I passed out our financials, we're a small club, and we can't handle that. We have to keep a little bit of afloat. So we've had to turn down these grants that were potentially there for us. And what we're hoping to do is that because of the trail system around town, it's a users group for everyone, and we're really hoping that the town can help us with either applying for grants or some way that we can do a joint cost. Even if we could get the town to help with the southern section to complete that one, it would be a great help to the club and would ease our monetary. And between the businesses in town, we might be able to then apply for a grant again with the NDIT to complete or to do maintenance to fix all the holes that are on the and if you want to call up those pictures just to show you how bad these trail systems, and again, it's the summertime use that we needed a multi-purpose trail system for everybody to use, but with that comes the hazards, as in, like I said, originally this trail, there was very little mud in that section, and now it's getting deeper, the holes are getting much deeper, and of course, it's a hazard because we have very young kids that are using these on the dirt bike trail. We have a motocross track. This trail system would be, a good asset for them to learn to ride their dirt bikes before they go on the track. But in the condition it is now in the summer, like this one right here, that is very dangerous. I mean, if we had young kids go in a bike, I'd be just afraid. I mean, unless there's vision. And the other issue that we have is being part of the rec sites and trails. We we said we want to be stewards of the environment, and looking at this does not, it's not our image that we want to portray to the town or to anyone else. That's why we're really hoping that we can get these sections done properly, or some drainage, we certainly need help because we can't do it on our own. And with the town that we can, work together to see if we can come up with a resolution, because I really hate to lose that trail system, because if we keep letting it go, it will be past repair.
Mr. Barry, we have Ms. Vanderstein, who does grant writing. Has she worked with Snowmobile Club?
We have used it for the NDIT one, but
Mm-hmm.
when it gets up to a certain amount, most of the grants that we've applied for, we had a 70-30 split, which we could manage at the time with donations. But we believe with this one here, the cost of repairing this with the fill and that, it's going to be way over our budget constraint. So that's why we would really like to be able to, you must be able to have the money available before you apply for the grant.
Mm-hmm.
And with $6,000 in the bank, we're just cash strapped. We just can't do it. But I know NDIT just increased, I think, their funding from 50,000 up to 100,000 with the same 70-30 split. So we do have resources to be able to do it. But again, the portion that we have to contribute ourselves, a little bit too deep for us to be able to come up with on our own.
Mr. Barry, are you familiar with the NDIT's new guidelines here for funding for this sort of thing? And has Ms. Vanderstein worked with this group?
So I believe Krista's worked with the group in the past. Like anyone who comes in any nonprofit, the opportunities there, and we work with them. It seems a bigger hurdle with the group is the funding hurdle, not necessarily the resource to help fill out the application or work through the application process.
Okay. Any questions for Mr. Millay? Mr. Penny?
Just wondering, you're at 110 or 115 members now. Do you guys spend any time counting to see how many people are actually using the trails, or pay attention to how many people are using the trails that aren't members?
We actually don't have an official count, but definitely I would say it's at least perhaps close to double using it, and other user groups that, because they're, we advertise under the Snowmobile Club to be members. Of course, I mean, you got people that are walking, snowshoeing, and then the quads and the dirt bikes, they don't, I don't think we have any members that are in that other group that contribute, but they are definitely users of the trail system. And trying to get those members in has been tough over the years.
I really wonder, trying to think back, the original ATV trails around Fort Nelson are now paved into a walking trail. And I do recall, we'd have to go back to some minutes of meetings to find out, I do recall a time when the town took these trails and turned it into a walking trail, that there was supposed to be some aid given to put new trails in. I just don't know how much contributed, if we have contributed anything at this point, but I mean, those trails that were here, I mean, they were basically built on the sweat and love of trail riding by community members. And the reason why I think that it made it easier to have the walking trail, the beautiful walking trail we have now, is because of how long that trail was packed down mainly by the kids of the community. And now we see what they need to go through to try to get around the town. So I'm not sure if there was any monetary relief that was set out at that time when those trails were taken away. Perhaps we could look into and just see if there was something at the time stated that would happen, because to date, not that I know of anyways, that there has been any help from the town.
2020 was a wet year, wasn't it? A small mud hole turns into a very big mud hole on a year like 2020.
Yeah.
If you use it at all. I was just thinking of how, a lot of mud holes like that on a dry year, if you sprinkle a bunch of reed canary grass seed on them this time of year, in there, as soon as it thaws out, and if you don't have a monsoon year again, that stuff starts to tighten up, and pretty soon you have a really cheap fix on muddy ground. But you can't fix something that's already pounded completely out.
So I know that we are looking at the whole parks and recs. We have some kind of a master plan coming out, right? Like, or about this, or like, I seem to remember that we have an initiative going, or is it just looking at the 2 parks? Or is it the whole trail?
What was,
Too many. So the Parks and Trail Master Plan that we have was just in town, parks and green spaces, so Art Fraser, HME, the demonstration forest, the community trail. But the next phase is intended to look at, more parks more regionally. But I mean, the scope is at this point relatively undefined. So if council wants to provide direction that plan look at motorized or include motorized trails as well as the other areas of investigation, then, you know, it's not set in stone by any means at this point, so it's entirely open for council's direction.
And Councillor Penny also wanted to look into whether or not some commitment had been made to fund trails around town. Is that correct, Mr. Penny?
Yes, but I would imagine we would need to word that motion, I guess, but I like to look back. I do recall at the time, because there was quite an uproar from ATV enthusiasts in Fort Nelson that these trails were being taken away. And the way that they were basically calmed down was that there was going to be some help there. But I have no idea what was said at the time, or what kind of.
We could request staff to look into that anyway.
wonderful?
I would make a motion that we have staff investigate back to the time when these trails, ATV trails were taken over for a walking trail. What, if anything, the council of the time had, dare I say promised, but I had mentioned that aid would be given to the ATV club.
You have a seconder for Councillor Penny's motion. Seconded by Councillor Gerwing. All those in favor? Carried. Now, Ms. McIver was talking about including the ATV trails with our Parks and Recreation plan. Councillor Gerwing?
Because this is the first that we've heard of it, I think I would like some time to think about that, like how, I don't want to lose, like I think that that's a really good place to investigate this. But I just think that because this is the first we've heard of it, we haven't really, talked about it or thought about it. Would it be like a placeholder for that? Like I don't want to just assume that this is where we're going to put this initiative, but maybe we could think about, is this the best place for it, or is there something going on that would be better? Because that's the future. That's not going to help this year, right? That's something that's going to be done into the future. So, if you're looking for immediate assistance, something like that isn't going to be the answer. So I don't know whether we need more information, like are you looking for some solutions for this quadding season, and then the other thing that I wanted to bring up, sorry not to change it, but there's also a trails not-for-profit starting in town. Are you guys involved in that at all?
Running this, I was on a couple meetings, but.
Okay.
Yeah.
Okay.
No, I don't think, it's not that we're looking for like immediate, but I think we've we have an issue, we have that we deem almost like a safety concerns with the younger riders. So we're just looking at something more, not immediately, but, something to build on to see what we can do to correct the problem, if it means join forces with applying for grants. So, like I said, our resources are a little limited. So to step forward with that, we just can't apply for the loans because we don't have the finance to back it. But we've had so much great success with our donations with the companies in town that have helped out. But again, that's something that, that's after when we apply for the grant, not before. And a lot of these grants, you need the money up front. You have to prove that you have to have the money. And like I said, most of the ones, the three that we have were a 50% and the other one was a 30%. And I think the cost to upgrade or to get rid of the drainage in this, we're looking at, I'm thinking it's gonna be like $40,000-$50,000 to do that top one. At least the time you put in the culverts, fill and proper drainage. That's the issue that we're having, but it don't have to be immediately. We know we have an issue and we want to correct it before it becomes too much of a problem that we lose that trail altogether. Because rec sites and trails can come and look at that and say, look, this is not what we vision for a trail or for a green space or for the environment, and up to them, we could lose that. And we put a lot of time, resources into it, and we sure don't want that to happen.
They don't have any money to put into it.
No, not in something like that, because...
Yes, exactly. So I'm wondering then if, that an appropriate motion might be to have staff investigate the best place to put this initiative, whether that's in the phase 2 of the parks and rec sites, or whether there's another place that we just aren't thinking of right now. I just don't want to lose track of it. But
before I get to your motion, I'm going to ask Councillor Andrews. You had your hand up.
I was just thinking also in the interim, is there any way the municipality or something we could look into is helping with sourcing and or supplying some fill and supplies? Like, do we have any way we can help out there? Maybe it's not a financial way, but maybe it's a way in lessening the financial burden.
I think the way we're heading here is that we need staff to do some investigating for us. I think we need to quantify the amount of money that would be needed to assist the Snowmobile Association. And as you say, Councillor Andrews, whether there's other ways that we could assist them. And Councillor Gerwing, your idea of a motion, I think, is a good one, that we instruct staff to investigate this. So would you like to enunciate that motion, and I will look for a seconder.
okay, so I would make the motion that we instruct staff to investigate the best project to, that we instruct staff to investigate possibilities of research and to research possible solutions for trails that have been identified tonight.
Can I get a seconder for Councillor Gerwing's motion?
Second that.
Thank you. It's seconded by Councillor Penny, who will now reiterate Councillor Gerwing's motion. All right, we'll leave that there. All those in favor? Carried. Thank you.
Thank you very much.
Thank you, Mr. Millay and Mr. Wheeler, for coming in tonight. We appreciate it, and thanks for bringing that to our attention. Can I get a motion, please, to adjourn the special regional council meeting? Moved by Councillor Gerwing, seconded by Councillor Souls. All those in favor? And we are adjourned. Thank you.